Hello YouTube, I'm Dr. Fox. Today, I'm talking about planning for pregnancy. It's never too early to start planning for pregnancy. Preconception health and healthcare provides you with strategies and steps to boost your likelihood of having a healthy pregnancy and baby. It can take some women a few months to prepare their body for pregnancy, while others may take much longer to get their health up to the level it needs to be. Whether this is your first, second, or sixth birth, the following are important steps to help you get ready for the healthiest pregnancy possible. Okay, step 1. Make a plan for good health. You have probably thought a lot about whether you want children, when, and how many. When you didn't want to have a child, you took steps to avoid pregnancy, such as taking birth control. If you are now thinking about having a child, you again need to take steps to make this happen, and getting healthy is a key part of having a healthy baby. You need to make a plan to improve your health and act on it. Step 2. See your doctor. When you are planning to get pregnant, it is important to see your doctor early on in the process. When you see your doctor, they will discuss several issues with you, including your medical history and any health conditions and medications that could impact your pregnancy and the health of your baby. Before getting pregnant, you need to make sure that any medical conditions you are suffering from are being treated and are under control. Common conditions include diabetes, sexually transmitted diseases, high blood pressure, eating disorders, arthritis, chronic illnesses, seizure disorders, and thyroid disease. Your doctor will also explain what behaviors and lifestyle changes will help you to have a healthy pregnancy and will prevent the occurrence of specific birth defects. In particular, when planning for pregnancy, you need to talk to your doctor if you drink alcohol, smoke, or use any illegal drugs. You will also need to discuss your home and work environment. Is your job stressful? Do you live or work around dangerous substances? And is your home life unstable or abusive? A doctor and other healthcare professionals can provide you with a range of support, such as treatment and counseling. Any issues with previous pregnancies will also be discussed, as well as vaccinations you may need before or during pregnancy or immediately after delivery. By getting the right vaccinations or shots when you need them, you can stay healthy and prevent illness in your child, including problems that could affect them throughout their lives. Step 3. Take 400 micrograms of folic acid every day. Good nutrition is important, not just for during pregnancy, but also before. In particular, women need to ensure that they are taking enough of the B vitamin folic acid a minimum of 4 weeks before getting pregnant and then throughout pregnancy. Taking 400 micrograms of folic acid daily can help to prevent birth defects that impact the spine and brain of the baby. Step 4. Don't drink, smoke, or use street drugs. The likelihood of preterm birth, infant mortality, low birth weight, and birth defects is increased if you drink alcohol, smoke, or use illegal drugs when pregnant. You need to stop these behaviors before you conceive to avoid these and many other problems for you and your baby. If you are struggling to quit smoking, alcohol, or drugs, help is available. See your doctor or contact a local support service. Step 5. Avoid toxic substances and environmental contaminants. In the home and at work, it is important to stay away from environmental contaminants, harmful materials, and toxic substances, all of which can harm women's and men's reproductive systems, making it more difficult to conceive. Exposure to even small amounts during pregnancy, infancy, childhood, or puberty can lead to diseases. Therefore, it is very important that you understand how to protect yourself and your family from harmful materials. Harmful substances include synthetic chemicals, metals, fertilizer, bug spray, and cat or rodent feces. Step 6. Get to a healthy weight and maintain it. Being overweight or obese increases your risk of a range of serious health conditions, including complications during pregnancy, heart disease, type 2 diabetes, and certain cancers. Of course, being underweight is also a risk factor for serious health conditions. The key to achieving and maintaining a healthy weight isn't about short-term dietary changes. It's about a lifestyle that includes healthy eating and regular physical activity. Your doctor can help you to get a healthy weight before you conceive to maximize your chances of a healthy pregnancy, baby, and life. Step 7. Address domestic violence. Domestic violence affects both sexes, but women are disproportionately impacted by domestic violence at all stages of their lives, including when they are pregnant. Some domestic violence results in the death of victims, but many other women survive and must deal with the emotional and physical impact of being physically abused. If someone is violent toward you or you are violent toward your loved ones, get help. Violence destroys relationships and families. Step 8. Learn your family's medical history. When planning for pregnancy, you should learn as much as you can about your family's medical history and share this information with your doctor. Several conditions are genetic, and based on what you tell your doctor, they may advise you to get genetic counseling. Genetic counseling may also be advised if you have suffered several miscarriages, infertility, infant mortality, or if you have previously had a child with a birth defect or genetic condition. Step 9. Improve your mental health. When we talk about mental health, we are talking about how we feel and think, and also how we cope with the problems we face in life. Physical health is important, but so is mental health, and the two impact each other. It is not unusual to sometimes feel anxious, stressed, or down, but when we feel this way for a long time and these feelings start to affect your life, you need to seek support. A healthy mind is also important for a healthy pregnancy and baby, so see your doctor and another healthcare worker to discuss how you are feeling and the interventions available. Step 10. Have a healthy pregnancy. Once you are pregnant, be sure to keep up all of your new healthy habits and see your doctor regularly throughout pregnancy and perinatal care.